Sprain your ankle and it should have gotten all better after a few days, but perhaps a few weeks or even a month or two have passed. It could be a bit more than a sprained ankle. You could have sustained a ligament tear, a cartilage injury, or even an undetected ankle fracture. Hello, I'm Tan Ken Jin. I'm an orthopedic surgeon. I specialize in the foot and ankle. Ankle sports injuries are a particular interest of mine. I practice at Orthosports at Mount Elizabeth Novena. Symptoms of a chronic ankle injury may be swelling. This swelling may be there all the time, or it might be worse after activity. The ankle may ache and hurt and feel unstable or insecure, particularly if you walk on uneven ground. So a typical patient with an unstable ankle from a ligament injury would have rolled their ankle at least once, if not multiple times. Usually the ankle, aside from having a history of multiple injuries, it may feel achy after activity because the ankle ligaments are important to stabilize your ankle even when you walk or run. Uneven ground makes the ankle feel insecure. Together with these symptoms, usually the doctor or I will examine the ankle and we will assess the ankle on stress examination. Furthermore, quite often we would do some imaging like an MRI scan to look at the quality of the ankle ligaments. If the ligament injury is not too severe, quite often we may be able to fit an ankle brace or guard and use rehabilitative treatment. But if the symptoms are worse or the ligament injury tends to be worse on the scans, we may recommend a repair of the ankle ligaments. This can be a very effective way to restore the function to the ankle. So these are some of the equipment that we use to do a ligament repair. A typical modern ankle ligament repair would be a tiny keyhole kind of surgery. And through these keyholes, we will insert something like this, which is like a little fish hook, where we would then hook the ankle ligaments that are torn and pull them back to their position. After that, the ankle ligaments are secured with some suture tapes and tiny plastic anchors like this one you see here. After a modern ankle ligament repair, most patients will get back good function in their ankle and the downtime is minimal. Most patients spend about only 2 to 3 weeks in a simple ankle brace after a modern ankle ligament repair. Now that we've talked about ligament repairs, in the next part we'll talk a little bit more about cartilage injuries and repair. Patients with a cartilage injury will typically experience a swollen ankle, and the swelling may be worse after prolonged activity like walking or sports. The ankle may ache a lot at night after activity as well. Typically, we diagnose cartilage injuries of the ankle on an MRI scan, and this would show an area where there's an injury or defect to the cartilage. In these patients, a keyhole cartilage repair or resurfacing can be an effective way to treat the cartilage injury. Inside the ankle, we will usually find broken bits of cartilage. We would then extract these broken bits and the defect is then resurfaced. One of the common ways that we will resurface this defect is we use a little suction device to pull the broken bits of cartilage out of the joint, and a little net device like this. This is like a fish net and the broken bits of cartilage are caught inside. These are then recycled back to patch up the defect in the cartilage. This procedure is called an autogenous chondrocyte implantation. Now that we've talked about cartilage injuries, next is fractures. So having an ankle fracture can also be a possible cause of a chronic ankle pain after an injury. You might still be walking around on the ankle because in our leg there are two big bones. There's the tibia bone and then there's a smaller fibular bone. And most people who fracture their ankle, they fracture the smaller fibular bone. And so because the big bone is still intact, you can still walk around on a fractured ankle. So if you are still limping after some time after an ankle sprain, you may actually have an undetected ankle fracture. It's good to detect these early because some of them require further treatment in a fracture boot, or in other cases may require surgical fixation. If you've had an ankle injury and it still hurts after some time, this could mean that you have some sort of ligament injury, cartilage injury, or an undetected ankle fracture, and it would be good to seek further treatment early.